Well, hello and good afternoon. We apologize, we're a couple of minutes late, but things happen, so we're thankful that you stuck it out for those 2 minutes that we're late. I'm joined today by Gary Herbst, our CEO. My name is Deborah Volison, and I'm the Director for Community Engagement here at Kaweah Health. As of Saturday, we are now Kaweah Health. And so we appreciate those of you who sent in questions. And of course, we will be watching the chat line. And any pressing concerns or questions that you have, feel free to chat them at us during this live event and we will address them. So Gary, welcome.
Yep, thank you, Deb. Good to be here.
Our last webinar ended with a technical difficulty with you saying, we've got a secret that we're going to let you in on. And so the secret was revealed last week as you are now the CEO of Kaweah Health. And we're going to talk about it a little bit.
Yeah, beautiful.
We'll talk about it at the end. So we finally revealed the secret 2 weeks later. But we are excited. There are a lot of great things happening here at Kaweah Health. But we're going to take a step back and talk about the numbers because this is what we always do at the opening of these meetings. We've been doing this now for quite a while.
Yes.
And so we don't want to get out of the swing of things.
Months.
Yeah.
No, just when we're starting to pick up momentum and let's keep doing it.
Let's keep doing it. Okay, so let's go over the numbers.
All right, so I decided for today that I end up spending so much time on the numbers that I don't leave ourselves much time for the other questions in the chat. So I'm just going to talk about really what's going on at the county level and at the local level at Kaweah Health, which will take us some time to get used to that. The Kaweah Health Medical Center, to be exact. So at the county level, we have now performed, and I apologize, I'm looking at my notes here. Where are the number tests? Gosh. Okay, I don't see it.
Okay.
But we now have reported 49,514 COVID positive cases over the course of the entire pandemic. We had 19 new cases just yesterday that were reported. We've had 837 deaths since early March of 2020, the beginning of the pandemic. The three different metrics that are used in the governor's blueprint for a safer economy. We're kind of holding steady from when we last met a couple weeks ago. So two of the metrics which deal with the overall positivity rate, the percentage of people that get tested for COVID that test positive. At the overall county level, we're holding right at 1.2%, which is outstanding. That qualifies us for the Tier 4 yellow category. And similarly, the health equity positivity metric, again, that same positivity rate, but in the more health challenged areas of the county, we're at 1.4%. So again, outstanding that the positivity rate that we're observing in those more difficult areas, where there's greater poverty, greater families living together, less access to health care, and there was a great and understandable concern that there'd be less access to testing and to vaccination. So to see that health equity metric at 1.4 is almost identical to the countywide metric, that's a really good thing. And that health equity metric actually qualifies us to be in that same Tier 4 yellow. The only thing that's holding us back from the entire county shifting into yellow is the average number of new daily cases per 100,000 population. So you have to be below 2, which when you think about our population, almost 500,000 people. So that would be 100,000 group. So 5 times 2 means that we would have to have less than 10 new daily cases in the county over a 7-day period before we would qualify to move into that Tier 4 yellow. And as I mentioned just yesterday, we had 19 cases, so almost twice the 10 cases that were required to meet. So as a result, that metric remains in the orange category, which is Tier 3. which is still a long way removed from Tier 1 purple. So we have come a long way over the last couple months, and again, my commendation to the county for doing a great job really following all the recommendations. Great job getting vaccinated. I'll talk about that in a moment. So what's really interesting though, is I shared, I don't know if it was the last time we met, so Governor Newsom has already come out publicly and stated that as long as our numbers kind of remain about where they are right now, and the availability of beds in hospitals, particularly ICU critical care beds, as long as that remains high, meaning a high number of beds available, which pretty much is the case up and down the state, then his intention is that come June 15th, just a little over a month away, that he would completely rescind the blueprint for a safer economy, and he'd open up the entire county, or excuse me, the entire state without any restrictions whatsoever. So there would be no capacity restrictions anymore. So restaurants could open to 100%, outdoor venues, theaters, places like that, but that they would still require mask wearing, still require safe practices, but that's we really haven't seen the details of what that might look like. So if that holds true, then certainly that will be a major game changer at both the county level and the state level. In terms of vaccinations, so we now have 153,000 Tulare County residents that have received at least one dose of the vaccine. And you may be aware that Johnson & Johnson has now been put back into active circulation. So we have 3 vaccines, the Pfizer, Moderna, and the Janssen or J&J vaccine that are being used throughout the county. The county has received a total of 324,000 doses of vaccine. So they have about 170,000 unused doses that are in storage right now, which is actually, it's somewhat shocking, because you may remember when the vaccine first became available back in December, everybody scrambling to get an appointment, and it was very, very limited in terms of who qualified, and absolutely the demand for the vaccine far outstripped the supply of the vaccine. Now that's completely reversed, and we now actually have much more vaccine at both the county and the state level than we have for the demand for the vaccine. We have seen that the number of folks that are signing up to get vaccinated is declining. We are seeing folks that don't show up for their second dose or don't show up for their first dose. They schedule an appointment through the My Turn platform, but then end up, I don't know if they change their mind or whatever, but they end up not showing up. And so, and we're seeing that really statewide and even a little bit on the national level. So Tulare County is really no different from that standpoint. So that's where we are at the county level. The news continues to be very, very positive here at Kaweah Health. As of this morning, we have 13 COVID positive patients that are in the Kaweah Health Medical Center. None of them are in the ICU or the ICCU. None of them are on a ventilator. So all of them are being cared for on a medical surgical unit. They are in isolation. Many of them are receiving breathing treatments, either high flow oxygen through a nasal cannula or BiPAP through a mask, but none of them at this time are intubated. We do have one COVID positive patient in the emergency department that is waiting to see if he gets better. Do we send him home, or do we end up having to admit that person? And then we have just under 20 of our employees that are still out on leave, and again, the vast majority of them are employees that were out before January 1st, 2021. And we check in with them to see, how they're doing. And some of them just aren't ready to come back. Some of them got hit pretty hard. And you've heard the term, the COVID long haul. So unfortunately, unlike maybe the flu where you fully recover and you have no residual effects, this virus is much different. And people that have ended up being hospitalized or out on leave for a month, 2 months, a lot of them are experiencing residual effects of it. Heart damage, lung damage, just feeling, tired, sluggish, cognitive issues. It's really been rather unpredictable and so varied and so not random, but just so varied across different people, ethnicities, underlying conditions. So it's still very serious out there, but we're definitely moving in the right direction, both at the county level and again here at Kaweah.
Yeah, well, I had a mild case of COVID. If people ask me, I had a very mild case, but I believe a residual effect from that has been that I don't have the energy that I had.
Right.
I get exhausted.
Yeah,
more
that
easily.
is actually one of the most common I hear. But even the absence of taste and smell, people 6 months after they recovered from the virus still can't taste and smell.
Right, and mine does come and go.
Does it?
It does, yeah.
Okay. Yeah.
So interesting.
Yes.
How it affects everybody differently.
Absolutely.
Okay, so we've talked about the vaccine and still being able to carry COVID if you've had the vaccine, which is very confusing.
Right.
It's very confusing. So a community member asked if you could still discuss the risks of being a carrier of COVID-19 after being fully vaccinated.
Yeah, and it's a fantastic question. It's the most commonly asked, and I think the most frustrating when you hear the answer. And I've talked about this over the last couple months. The Pfizer and Moderna vaccines, which are both the messenger ribonucleic acid. It's kind of a new approach to developing vaccines for infectious diseases, but is proving to be highly effective. They inject into you essentially this messenger RNA molecule that carries a code, and when it enters your body, it kind of tricks your cells into thinking that you have COVID. It tricks cells into creating a protein that has those spikes on it, either in whole or pieces of it, and then that triggers your immune system to start developing the antibodies to attack that what it thinks is COVID, and that molecule then disappears and your antibodies are left behind. And then the vaccine also comes with some sugar and some salt and some fat just to help it. So both Pfizer and Moderna have been developed pretty much identically. They're both mRNA vaccines. Why one is 21 days between doses and the other is 28, I would imagine there's maybe some subtle differences in the RNA molecule. But in both those studies, which included tens of thousands of participants, they really were just studying how effective the vaccine was at preventing somebody from becoming seriously ill, hospitalized, or dying of the virus. And so what they really were interested in is the people that they gave the actual vaccine to and not the placebo, that they wanted them to get exposed to COVID and to contract COVID, but to see how asymptomatic they were, or how well the vaccine prevented them from getting very sick. And they found in both cases with Moderna and Pfizer that it was 94 to 95% effective in keeping a COVID positive person from getting very sick and from going into the hospital. They did not see that it really prevented somebody from actually contracting the virus. And that wasn't their intention. Their intention wasn't to keep you from getting the virus. It was to keep you from getting really sick. And now that it's been out there for a while, they're studying the real life experiences, and it's just confirming that it's highly effective in preventing. So that's why, disappointingly, we heard that we still had to wear masks even after we got vaccinated, because again, it didn't prevent you from contracting the virus. It just prevented you from getting really sick. So, but if you contracted the virus, you could be totally asymptomatic, which has been the case since the very beginning of the pandemic. Even people that didn't get vaccinated, there wasn't even a vaccine yet, but they would contract the virus and never feel a thing. Right. Totally asymptomatic, which made this a highly unusual virus where you get the flu, everybody knows you have the flu. You know you have the flu and you stay away from them. Not true with the coronavirus. So that's why they said you could still get the virus and you could still transmit it to somebody that hasn't been vaccinated. And so that's why they've wanted us to continue to wear a mask, is for that reason. But interestingly now, as they continue to study how the vaccine is actually behaving out there in the real world, they are finding that it appears to be preventing people from getting the virus altogether. They're seeing that a pretty low number of people that have been vaccinated have actually ended up contracting the virus. They also believe that even if you do contract the virus, there is a very low probability that you can transmit the virus to somebody else. So if that's the case, and that really holds true, then that would be the evidence that we want, that you don't have to wear a mask anymore, because the risk of you transmitting or contracting the virus is so low now. But we're probably not there yet. So we need to learn more. So that's, and I know that's the very frustrating part, is because we hear that, okay, if you're at a gathering, say a small gathering, and all of you have been vaccinated, and you're indoors or outdoors, but let's say you're indoors, why can't we not wear masks? We've all been vaccinated. Even if some of us contract the virus, we're probably not going to transmit it to somebody else, and even if we do, they're not going to get sick. They're not seriously sick. And so there's a lot of folks that are out there saying, yeah, that's right, you don't have to wear a mask if you're around and you know that everybody is vaccinated. And when you're outside, even if not everybody has been vaccinated, the risk of transmitting or even contracting the virus outside is much, much lower. Right. But I mean, I'm as frustrated as anybody. What's coming out of the CDC, what's coming out of the White House, what's coming out of Dr. Fauci's mouth, it's all over the board. Do you wear a mask? Do you not wear a mask? And I heard the other day, children that go to day camp this summer have to wear masks except when they're eating and swimming, even if they're outdoors. And we're saying, all the evidence, the scientific evidence, indicates that children, especially outdoors, aren't contracting the virus. And if they do, they're almost always asymptomatic. They feel fine. Right. So, there's not a straightforward, I don't know the person that asked this question, I don't know if you're leaning towards that because we don't know definitively that if you're vaccinated, you can't catch the virus and give it to somebody else. We should be wearing masks still. I'll tell you, at the hospital, we still require mask wearing. So every employee, even when we're all vaccinated, and we have probably over a 60% vaccination rate, but if we're meeting together, we still socially distance, we still mask. The great thing is we now no longer, our clinical staff that are taking care of COVID positive patients, non-COVID patients, they no longer have to wear an N95 mask and a shield. And that was a happy day when we were able to announce that. Right. But still, everybody has to wear a surgical mask.
Okay. So I'll ask you a couple of questions that weren't planned. So back in the probably spring and summer, we talked a lot about people who got COVID then had a 3-month immunity. And we kept saying once studies come out, we'll see if that, do you know if that 3-month immunity is different?
Yeah, and I can't remember if that's exactly was it
maybe
immunity?
A 3 to 6 months.
I think they wanted to wait 90 days because they suspected that might be the immunity period before they. I don't think it was before you got the vaccine. It's before you, got tested.
Yeah, just after you had it. Yeah, before the vaccine.
Yeah, I don't know. We definitely, well, I think not we. So scientists, the CDC, all those that are advising us Americans have indicated if you contracted the virus, you should still get vaccinated for it. And I know a lot of people have done that. A lot of people have chosen not to, and it could very well be that's the population that's deciding not to get vaccinated is because they know they had COVID, they tested positive, and they fully recovered. The scientists have indicated that they believe that the natural immunity that occurs from actually contracting the virus appears to be somewhere between 6 and 8 months. And so they believe that the vaccine antibodies and the immunity will have about that same duration, the same 6 to 8 months. But I do know, and I think you gave an example of maybe your son-in-law, that if you had the virus and you had a pretty strong case of it, your reaction to the vaccine might be actually pretty moderate to severe. And that's, I guess, maybe because you now have a double dose of antibodies, and so your immune response might be a lot stronger. And so a lot of folks are deciding not to get the vaccine for that reason.
Well, I got the vaccine 10 days later, maybe 11 days later, but now I'm at the end of that 3-month, what we've been kind of claiming as a natural immunity period. So I was feeling like Wonder Woman for a while, but now
I think you still can, because again, I'm not really hearing the 3-month. I'm really hearing more of a 6 to 8 month. Which is again a lot like the flu. We get at the hospital here, we generally get our flu vaccine late September, early October, and it lasts till March or April over the duration of the flu season, which is again kind of that 6-month period. So they believe that again natural immunity or vaccine immunity gives you about that same 6 to 8 month protection.
Okay, I'll test you with another one. My daughter got hired, and she was doing her pre-employment, blood test and all of that. And so she's 26 years old, and they were kind of shocked that she had gotten the vaccine because she's so young. So they had to put off her TB test for 4 weeks after her last vaccine. Have you heard of any kind of interaction with the TB test?
I have not.
Yeah, that was the first I had heard as well.
Yeah, but then again, I got my flu shot and my TB test in October, and then got my vaccine in December. So just the opposite. This was your daughter?
This is my daughter.
Your daughter. Yeah. Yeah, I had not heard that. My daughter works at Long Beach Memorial Hospital. She's 29 today.
Oh.
Yes, my twins, both Kevin and Kelly, turned 29 today. But she got vaccinated right when she went to work there, and also had to do the pre-employment screening, the TB test and everything like that. So she never mentioned having to wait for that. So
yeah, it was the first I had heard of it. So
I had not heard of that interaction.
Okay.
Yeah. Now I have heard, as we have, that getting the vaccine can make, I don't know if this is just in women, but can make lymph nodes swell, or they really advise not getting your mammogram right after getting the vaccine because it could give you a false positive.
Oh.
Yeah,
Okay.
so they were advising to wait a period of time between vaccine and mammogram for that reason.
Okay.
So I guess it can cause people, their lymph nodes, to flare up
Okay.
as you have that immune response.
That's good to know. That's really good to know. All right, so all over the news, the surge in India.
Yes,
It's quite scary.
it is.
And I have a friend who was just in India, and he was kind of talking, sharing on Facebook what's kind of going on there. You know, there's a huge caste system there anyways,
Right.
politically and socially. And are you watching that?
I
Are
am.
you concerned?
I am. Interesting that this question came up. So just last week, I sent my son, Kevin, and his wife, Evie, who he's 29 today, I think she's 30. They're really on the fence in terms of getting the vaccine. So my daughter and son-in-law, they've both got it, but my son and his wife, my daughter-in-law, have not got it. And as we've been seeing more and more outbreak in the Midwest of the United States, and definitely in Europe and India, and hitting younger people more and more, I've been sending him information to try to encourage him to get that vaccine. And I last week received, I get a daily electronic newsletter from the Healthcare Advisory Board, and there was an article all about the India outbreak. And apparently what they're experiencing is what they're calling a double mutation. We see these variances that are appearing in Brazil, South America, the United Kingdom, but apparently in India, they're actually seeing two variants at the same time within the same virus. So the people that they're testing and doing the epidemiological tests on it are actually detecting two separate variances in the same virus. And so for that reason, they believe that it is hyper contagious, causes much more severe illness, causes death. They're seeing 400 to 500,000 daily new cases. They're experiencing thousands and thousands of deaths every day. Their hospitals and their morgues are overrun with COVID patients and sadly COVID deaths. They attribute it a lot to, I mean, India is obviously an incredibly populous country. And just the culture there's a lot of congregate living, a lot of families living together under a common roof. And so there's much more, the closeness, the proximity of people, right on top of each other. The cities are densely populated, so that is a major risk factor. And they appear to be having great difficulty in procuring vaccine. And so they do not have the same vaccination rates that we're achieving here in California or Tulare County, or even the country. All those factors are compounding to create what now is probably the single largest, most significant surge that we've experienced throughout this entire pandemic. We are seeing that in other parts of Europe as well. And I think that causes us to be very nervous here. It certainly got my son's attention because one of the things the article also said is that, and this is true of our country, is that something like 70 to 75% of people aged 65 and older have been vaccinated, but a very low percentage of young people have been vaccinated. So the concern is that this virus doesn't want to go away. It doesn't want to die. So it's going to direct its attention to another host. So if elderly people now, are creating the herd immunity among the elderly, then it's going to shift its attention to the younger population. And that's what India is seeing, that more and more people aged 26 and older are ending up with the virus, ending up being severely ill, hospitalized, and even dying. And so that I think is what really caught my son's attention, is that's my age group. And while this is India we're talking about, and I believe we've imposed travel restrictions in the US to and from India, but we know how the virus has traveled across the world, and So I think the concern is perhaps this double mutation will eventually enter the United States. One of the things I reported on at a previous broadcast is that the concern about these variants and the vaccines, are the existing vaccines going to be just as effective at combating these variants? And the scientists and the drug companies believe so, but they have said that some of these variants, particularly I think it was the South African variant, was proven to be rather elusive in terms of eluding the antibodies that are created by the vaccine. So we may have a great immune response and a great pool of antibodies, but if this variant, if we're infected by the variant and it's able to somehow stay clear of the antibodies or reduce its effectiveness, then is it possible for us to end up getting sick and maybe being hospitalized even though we've been vaccinated? So again, that's been the underlying theme behind this whole pandemic, is the vast uncertainty that exists. We just have not had enough time to study all the different variables and the what ifs.
Right. Well, my friend was sharing with me that remdesivir used to cost 5,000 rupees in India, and now it's between 35,000 and 50,000.
Wow.
So it's creating the divide even deeper between the rich and the poor.
Yep.
And plus the water situation there for their culture, the villages outside. I mean, it's really, really, and I'm surprised he actually was able to come back into the country this year, or this week, and I was
Maybe
like, how did he get in?
Yeah.
But just, it makes you grateful to live in this great country where Kaweah Delta, we take care of you, whether you can, or Kaweah Health, whether you can pay or not. And it, just the fact that so many of these people, they don't even have a chance at healthcare or medicines due to the situation they were born into. Very, very sad. Okay, so we'll keep watching that, and but our numbers are going down, so we're feeling good. Now we're ready to just open up. But speaking of opening up, the ED. 2 weeks ago, we had a plan.
So Zone 5, when you talk about the ED opening, that's the Zone 5, the final piece of the 2-year-long expansion project, adding 24 new exam rooms and 3 dedicated triage rooms and 2 negative pressure rooms, and again, it's a more than 100-person lobby. Beautiful. So we had our California Department of Public Health inspection, and I think it went very, very well. But as expected, they always will find a couple minor things. I think there was an eye wash station that they wanted to see. I don't know if they wanted it mounted differently on the wall or in a different location. It was really probably a handful or less of findings. And so on Tuesday of this week, we submitted our responses to those findings, which we've essentially fixed everything that they wanted fixed, and we took photographs of those to demonstrate, and we've sent those to CDPH. So it is possible that they sign off by today or tomorrow. We're sitting waiting now. We don't think they need to come back out. We think they can just do a desk review. But so we're expecting to hear back any day. And then we wanted a couple days between that CDPA sign off and open for business. So I'd like to cross my fingers and toes and say we will officially open sometime next week.
And so do we go to the back of the line again once we...
No, I don't think so.
Are we put in a different category?
Because I think, because you never know who's going to show up, who they're going to sign for the initial survey. But now that you get a team that's been assigned to you, I think we get to work directly with that team.
Okay.
And so they know that we're waiting on just the final sign off. So
And we had just opened our Tulare clinic right before our last webinar. We had our grand opening.
Yeah, we
on
did.
Monday.
So Monday, the Tulare Chamber of Commerce, Donette, hosted our grand opening, and we had the Tulare City Council members there. Mayor Dennis Medeiros was there, Jose Segala from the City Council, a couple other council members, Pete
Vanderpool.
Thank you. Pete Vanderpool from the Tulare County Board of Supervisors was there. We had a representative from Congressman Nunes's office. We had a representative from Assemblyman Mathis's office. Gil Jaramillo, who is the president of the Tulare Kings County Hispanic Chamber of Commerce, was there, and all of them spoke and presented us with different proclamations. And then we took everybody on a tour, and it was a great event, great turnout. Got the opportunity again to thank all the City of Tulare leaders for their incredibly warm welcome and all the support. And it was really neat. A couple of the presenters told stories about their loved ones, their mom, and I think it was Gil himself, who had been patients at the Kaweah Health Medical Center over this last year and had really received life-saving care in a very compassionate, empathetic. They couldn't talk enough about the incredible experience, and Gil credits Kaweah for him actually still being on this earth. And so yeah, it was a fun event.
Yeah. City of Tulare has been very welcoming.
They have, absolutely.
They've been very excited about us being there. So rebranding, that was a big deal. A big deal.
Yeah, that's why you only do it every 60 years, you know. It is a big deal, yeah.
Yeah, so how has the feedback been from our employees and from the community?
Yeah, it's still coming in, obviously. People are still reacting to it. As I was walking over here, there was a group of COS nursing students that were out on the grassy knoll out in front of the Kaweah wing. And we had one of our new Kaweah Health banners that was flying out there. And they surrounded themselves around the banner, went taking selfies and pictures and everything. And I went up to them and I was talking to them, and I don't know if you know, the COS colors are orange and blue.
Yeah.
And so they just blended it perfect with our with our new brand and logo. So they were very excited about it. I would say that the response has been overwhelmingly positive, disproportionately positive. There has been, and I'll be totally transparent, there has been some negative reaction by both our employees and community members, and it's been singularly focused on the financial piece of it, the cost of it. Even though we did it at a fraction of the cost that virtually every organization, healthcare or otherwise, incurs to go through a major rebranding, because we did virtually all of it internally. And the only cost, the biggest part of the cost is just the signage. And if you happen to go by the Tulare Clinic and see the sign, it is beautiful. It is modern, it exudes energy. I mean, it's eye-catching, and it just, you look at it and you go, you feel confident that place, I know I'm going to get great care there, because they apparently take great pride in what their facilities look like and what their name looks like. And but that is, the definitely the negative feedback we get from staff is what we expected, that we didn't get a pay raise this last year, and you didn't make a match to our 401k, but you found the money to make this rebrand. And when we get the opportunity to talk to them about it, to answer the why, to explain that this actually, in many respects, is directly related to regaining our financial strength through a common brand and creating that loyalty and helping our community understand all the different services that Kaweah offers that you wouldn't know it right now because they don't bear our name, and so you don't go to them. You might be very loyal to Kaweah, but you don't go there to get physical therapy because it doesn't say Kaweah. It says something else. So when you get the opportunity, and I've got to meet with a number of our employee groups, and usually by the end of the that discussion, it's like, wow, okay, I didn't, thank you, I didn't, I'm excited now. So the videos, I've done a number of videos to help tell the why to the community and to our employees, but it's just not the same, as having that interaction and answering questions and everything. But I think as more people, start talking about it and start, wearing their badges with pride. And again, I think I've only received one negative message from a community member, a physician who I know well. But I've received lots of emails from community members. I received an email from Margaret Foley's daughter, Sarah. So Margaret was a longtime nurse here at Kaweah. She was on the board of directors at Kaweah. And her daughter, Sarah, sent me an email just congratulating us, just praising us, and said my mom would have been so proud. And yeah, so that was kind of neat.
Yeah, it was so funny when we did the press conference and everyone's geared up for the big banner to come off the building, and then it just goes bloop, and you said, well, we said we were doing it on the cheapo.
Yeah, at least it was a cold, windy morning.
Oh, it was freezing.
None of us were expecting that.
Yeah.
And so we're all worried that when it unfurled, it was just gonna fly off in the air or get all caught up, but it actually came over quite nicely. So there are many signs throughout the organization that will be replaced in the coming months. I wish it would happen sooner. The Kaweah Health Medical Center, you probably saw, we took down the Kaweah Delta Medical Center, the lit letters up there and the logo. We took those down in preparation for the new sign going up. But because it is being affixed to a hospital building that is certified by the Office of Statewide Health Planning and Development, or OSHPD. Any sign change that touches an OSHPD licensed building has to go through their in-depth analysis and review. And so it may not be until September before we see the Kaweah Health Medical Center sign up there, which we'll be patient. We've waited 60 years, so we can wait a few more months.
Well, so you've officially become the CEO of the first pandemic, the CEO of a rebranding after 60 years. So what's next? What other bucket
there.
list are you trying to take us through?
In threesome?
Yes, they do. Don't remind me. But I'm really excited. There was a real air of excitement the day we announced the rebrand and we got our new badges, and I don't care that we're doing it on the cheapo. It still looks great, and it's very exciting. So. All right. Well, I think we have covered all the questions, Gary. So I'm going to let you close this out.
First, huh?
This is the first. Well, he still has his ending, so he might.
No, it's just short and sweet. So again, thank you all for joining us today. Whether you're streaming with us live or you may be catching this on a later recording, appreciate again all the great questions. I really enjoyed the dialogue. Definitely invite you. You saw Deb firing a couple unscripted, unplanned questions at me, and that's okay. So if a question pops in your head and you want to chat it in, definitely encourage that. And also just if you ever want to email me, you just have a question offline, something comes up. I'm not the greatest at getting back to email right away.
So CC me.
If you CC Deb, she's right up at the top of my email priority list. But we just, again, this is just one of many ways that we hope to better connect with our community, to better engage with you, and again, our commitment of being transparent and forthcoming, to be your source of truth. We want to continue having that kind of relationship with you and building upon it. So again, thank you for hanging in with us over these 15 months now, and we'll continue to hope that we're going in the right direction. Keep doing all the great things that you're doing to keep you and your family safe, and I think we'll see you back in a couple weeks.
Yeah, thank you.